Hello, everyone. Today we're going to be talking a little bit about COVID-19 101. So we're going to talk a bit about the virus that causes COVID-19, a bit about the disease, how it's transmitted, how we can prevent it, and also how we investigate cases of COVID-19 when they are reported to us. All right, so COVID-19 is one of several types of human coronaviruses. Now, you may have heard of coronaviruses before because these can cause the common cold, for example. There are quite a few out there that we see every winter that just cause your average common cold. However, what's different about COVID-19 is that this is a special coronavirus that has not been seen before. It's sort of emerged as a novel virus. This particular one was first identified in the Hubei province in China in late 2019. At this point, the source of this virus is not entirely clear. Some folks are saying bats are a possible animal host, but what we do know is that there were connections to some of the early cases of COVID-19 in China to live animal markets. In the past, we've actually had other times where there's been an emergence of a novel coronavirus. The most recent example, of course, is MERS, or Middle Eastern Respiratory Syndrome, CoV. That was in 2012, and the animal host that was related to this syndrome was camels. And then back in 2003 was SARS-CoV, or Severe Acute Respiratory Syndrome. Sometimes you'll hear this one referred to now as SARS-CoV-1, because SARS-CoV-2 is our current COVID-19 virus. In 2003, SARS-CoV-1 emerged, and that seemed to be linked to civet cats. Of interest, SARS kind of came and went. We really don't hear about any cases of SARS right now. MERS, however, you still hear about isolated cases every year. And the jury is still out, of course, as to what's going to happen with COVID-19. So some fast facts about COVID-19 in Montana. Just note that this data is current as of today's presentation, which we're recording on July 7th. So obviously, if you're watching this later in the year, you'll see different numbers in the recent news than you will hear on this slide. As of right now in Montana, we're well over 1,300 reported cases in 39 counties in the state. This includes 117 hospitalizations and 23 deaths. And right now, COVID-19 seems to be affecting many populations, but especially the Native American population in Montana. In the general population, we have about 8% Native Americans. And as you can see on this slide, 13% Native Americans are being affected by COVID-19.
We wanted to update you on some information regarding how COVID-19 has impacted our nation. There's been over 42 million cases, almost 700,000 deaths. Of these deaths, at least 90% listed underlying conditions as the cause of death. When broken down into death by age group, you can see that 500,000 or 500,000 cases of the 700,000 total are made up by 65 and older, demonstrating that they really are our most vulnerable population. 45 and younger had a death rate of 3.3%, and between 45 and 64, there was a 19% death rate. Another update is the emergence of variant strains of COVID-19. Within Montana, we are currently seeing Delta as our dominant strain. But here is a list provided by the CDC showing the different strains and what percentage they comprise of the U.S.
If you want to see the most recent up-to-date data on COVID-19 in Montana, you click on the link or use the link that's presented in this slide to visit the Montana-specific COVID-19 site. This will connect you to several different things, including a live map that's updated every day with newly reported cases, testing information, whether or not the cases are hospitalized, the active versus recovered cases. It'll also link you to some demographic pages where a lot of the underlying data resides in terms of cases by county, racial breakdowns, gender, percent of our cases that were acquired outside of, or were acquired by out-of-state residents, etc. So please feel free to visit that to get the most up-to-date information on COVID-19. So a little bit about the disease. So remember, the virus that causes COVID-19 is called SARS-CoV-2, but the syndrome is called COVID-19. There's quite a few symptoms that have been connected to this illness. The most common are fever and chills, cough, and shortness of breath or difficulty breathing. As you can see by the list on this slide, there are quite a few other symptoms that have been reported from individuals who have been diagnosed with COVID-19. One of the interesting ones that we've noticed, especially here in Montana, is the new loss of taste or smell. This is definitely something unusual and is not really typical to most coronaviruses. But the spectrum of symptoms definitely varies. Some people have mild symptoms, other individuals can have severe symptoms, and still others might be asymptomatic when they're diagnosed and never have a symptom at all. So SARS-CoV-2 is transmitted by person to person or droplet spread. And then the interesting thing that we're finding at this point about SARS-CoV-2 is that people can be infectious from 2 days prior to their onset of symptoms until they start to recover. So later when we talk about investigating cases of COVID-19, this actually plays an important part in that investigation and determining when people are infectious and when they could have potentially spread it to others. This is a really good image of the infectious period of COVID-19 that is from the Johns Hopkins School of Public Health. This shows over calendar days when the incubation period is for COVID-19, which again ranges from 2 to 14 days, on average is about 5 days. But then the infectious period can be, the infectious period starts when somebody has symptoms of COVID-19, but they are infectious 2 days before. And then the illness can extend for anywhere from 10 days to 2 weeks to many months, depending on the severity of infection. Most people recover without too much incident after about 10 days, but obviously some people can progress to more severe disease and include hospitalization and sadly even death. This slide definitely shows a nice example of when people are considered the most infectious. And again, this helps when we later investigate cases to determine who might be at risk from an exposure to the person with COVID-19. So how do you prevent COVID-19? Well, a lot of the things that you can do are things that we advise people to do pretty much all of the time for infectious diseases. That includes good hand hygiene. Wash your hands thoroughly and often. 20 seconds with soap and water is the easiest way to get that done. Try to avoid touching your eyes, your nose, and your mouth. Or if you do, make sure you wash your hands immediately after. Cover your coughs and sneezes with a tissue or your elbow. And one of the most important things that we can do sort of as a community here is to stay home when you're sick. Keep your kids home if they're sick. Try to keep, in case that illness that you're feeling like you're coming down with is COVID-19, it's best to be extra cautious and keep people home until you know for sure. You can also clean and disinfect frequently touched objects and surfaces, and then maintain appropriate social distancing. And what this means is that you stay 6 feet apart and you try to keep those interactions with people, if you need to have interactions, as brief as possible. If you can't, then we advise folks to wear a mask. A mask may not prevent you from getting COVID-19, but it certainly will reduce your risk of getting COVID-19.
An exciting update is the availability of vaccine. As many people know, there's currently 3 vaccines on the market, Pfizer, Moderna, and Johnson & Johnson, all shown to reduce individuals' chance of getting COVID-19 and preventing them from going to the hospital.
I wanted to take a second and talk a little bit about quarantine versus isolation when it comes to COVID-19. You'll hear these terms being used frequently, and sometimes they get confused. So I wanted to take a few minutes to talk about the difference between these two terms. If you are diagnosed with COVID-19 and are considered a case of COVID-19, that means that you are likely infectious and could spread it to others. In order to prevent that as much as you can, we ask people who are a case of COVID-19 to be isolated to home or be put into isolation. This, of course, keeps someone isolated to their own home, limits their interactions with other people, keeps them from going to work, et cetera, to prevent the transmission to other people. You can be released from isolation when you've met several clinical requirements, and those include that it's been 10 days since you first had symptoms, that your symptoms are improving, and that if you had a fever, it's been gone for at least 3 days without the use of fever-reducing medication. And this, again, helps keep the person who's a case isolated and reduces the chances of transmitting to others. Now, quarantine is a little different in that it's meant for people who have been identified as a close contact to a confirmed case. So these folks don't necessarily have COVID-19, but they've been exposed. And because the incubation period for COVID-19, as we discussed before, can be up to 14 days, we ask that anyone who's considered a contact to a COVID case be put into quarantine in order to reduce the chances of them spreading it to others if they develop symptoms during that incubation period. And that's why the 14 days is important. While you're in quarantine, you're usually asked to monitor your symptoms. That may include checking your temperature a couple times a day. And if you do develop symptoms, to be referred to your healthcare provider for assessment and possibly testing of COVID-19. So again, these two terms will be used interchangeably, but there is a specific term that's designed to be given to either a case of COVID-19 or a contact of COVID-19.
When an individual becomes infected with COVID-19, they begin their isolation period. Isolation and quarantine often get confused. However, a good way to remember isolation is isolation equals infection. So day 0 is either symptom onset or test date, depending on whether an individual is asymptomatic or symptomatic. For those with mild to moderate symptoms, they will quarantine for at least 10 days since the beginning of their symptoms. They need to be fever-free for at least 24 hours without the use of medication, and other symptoms should improve. For individuals that are asymptomatic, it is 10 days since their test date. And then for individuals that are severely immunocompromised, a test-based strategy should be considered when deciding whether or not they should be able to be released from their isolation period. Quarantine is for individuals that have been a close contact to a confirmed case. So their quarantine period will begin after the last date of their exposure or their contacted date to the positive case. There are now 3 different quarantine options that each county can elect to employ. Those options are 7-day quarantine, 10-day, and 14-day. Most counties do allow a 7 or 10-day quarantine. A 7-day quarantine entails individuals being quarantined for the full 7 days but receiving testing on day 5, 6, or 7. With a negative test and no symptoms, they are able to be released from quarantine after day 7. A 10-day quarantine involves no testing, and with no symptoms, the individual can be released after day 10. Also, you can employ the 14-day quarantine, which is the traditional one, I guess you could say, and it involves a person being in quarantine for 14 days. They receive no testing, and with no symptoms, they're able to be released from quarantine after day 14. And this is highly recommended in healthcare settings. So one important note is in households, if you have an individual that tests positive, everyone else in the household that is close contacts will begin their quarantine period after that confirmed cases isolation period. So for example, if you have a kiddo that tests positive, they would complete their 10-day isolation. After the end of their isolation, everyone in the family that is a known close contact would begin their quarantine period. If you have any questions, please reach out to anyone at the state and we'll be able to walk you through this as well. Per the CDC, there are certain circumstances when close contacts do not need to quarantine. This includes if someone is fully vaccinated and has no symptoms, and if someone has been previously diagnosed with COVID-19 within the last 3 months. However, it is important to remember House Bill 702 when recommending this guidance.
So when you have a case of COVID-19, the question is, as cases start being reported, when do you start doing case investigation and contact tracing? So when you're in the containment phase, case investigation and contact tracing continues until you're at capacity. If the transmission becomes widespread, you might shift towards a more community-wide prevention measures like stay-at-home orders or closing down restaurants to in-restaurant dining, etc. The suppression phase is later on. So once some of those control measures have been put into place and you start to see the number of cases declining and it's not as widespread within the community, you can continue case investigations, of course, but you won't fully lift those control measures until public health feels like those cases have declined to a rate that doesn't pose as much of a danger to the public. And with that, we're going to talk about case investigation. So at this point, you've learned a little bit about COVID-19 and how it is spread. And now we're going to talk about how in public health nurses and investigators will investigate a case of COVID-19 and try to, again, prevent the spread to others through this investigation. So there are several steps involved in a case investigation, and we're going to go through those in the following slides. So a few items about disease intervention skills. As you're doing these case investigations or assisting public health with their interviews, a few things you want to consider. You want to make sure that you reiterate and apply all of the things that you learned in a previous section about confidentiality. You want to make sure that you can build a rapport with the individuals that you're talking to. Use plain language, don't use acronyms, make sure that you are active listening, and then you ask some open-ended questions to get as much information as we can through these interviews. Take note that if there's anything that shows that maybe someone might benefit from social support and counseling, that they can be referred to those services as needed. And then always follow standardized procedures. So this may mean a script that you're given that you need to follow when you're interviewing people, or just standard procedures that we'll be going through in terms of how to interview someone with COVID-19. So to be successful at these interviews, you want to make sure that you're familiar with what COVID-19 is, what COVID-19 looks like in Montana. Remember that there is a really great website that you can go to learn, the most up-to-date information before you begin your interview. It'll help you understand where the hotspots are in Montana, or what demographic populations are being most affected by COVID-19 that might help you with your interview. Make sure that you remember to be familiar with the investigation processes that we have here in Montana, as well as confidentiality laws. And different states are going to have different ways of doing this, so obviously to be familiar with Montana's policies would be very helpful. And then make sure that someone's gone over with you on how to record and report the data that you're collecting during these investigations. So step one is identification of the case. And this is usually occurring behind the scenes, if you will. Laboratory results are coming in to either electronic disease reporting systems or by secure fax or by even phone calls. The first report of a case is not necessarily saying that this is a confirmed case. So one of the first things that we do in public health is absolutely verify that this is a case of COVID-19. Generally, that will be because there is a lab report that says so, but sometimes a healthcare provider may call and say, you know, I'm calling to report this case of COVID-19. This person's a known contact to a case and they have all the signs and symptoms. I'm not going to test, but I'm verifying this is a case of COVID-19. So make sure that we're dealing with an actual case. The next thing we want to make sure that we do is verify that the individual who tested positive is a resident of Montana. We only count Montana residents for Montana case counts. And this is something that all states actually do as sort of a all state agreement, that we all count our own residents. If we determine that someone is an out-of-state resident, then public health will make sure that all of that information about that case is transferred to their home Department of Health. We want to make sure that any investigations of new cases are begun within 24 hours. At this time, this is absolutely possible with the numbers that we have in Montana, but you may be familiar with other states that have thousands of cases reported every day, and that becomes a bit difficult. If that happens, then you want to consider prioritization. And again, all of this will be done under the guidance of your public health officials in terms of, do we need to prioritize investigations? And if we do, what criteria do we use? Suggestions are high-risk occupations, vulnerable populations like folks who are residents of long-term care facilities, or perhaps individuals who are symptomatic versus those who are not. An excellent point also to make is that you want to make sure to protect yourself as well, that these communications and interviews are done virtually or by phone as often as you can to minimize your exposure potentially to COVID-19. So again, I'm not going to talk too much about this slide, but from the other slide, when we mentioned that there's a potential to have to prioritize case interviews, this is some guidance from CDC that goes over how a public health agency could set those priorities for how they go after interviewing certain cases. So I'll leave that there for you to read, but suffice it to say that, you know, should this happen in Montana, public health will definitely make that clear as we move along through investigations. Okay, rapid notification. Again, this is, now that we've confirmed the case, we want to make sure that notification has occurred to the patient. Public health doesn't necessarily want to start interviewing somebody before they've been informed of their diagnosis. So generally, we wait for healthcare providers to notify the individual that they're positive for COVID-19. If time is of the essence or the healthcare provider is not available, then sometimes local health departments will go ahead and notify. But in general, try to refer that to the healthcare provider. Some things to consider: there might be some language barriers, there might be some assistance required for folks who might need translation or other sorts of services. And then sometimes we can run into issues with not knowing how to locate somebody. So sometimes other health departments have come up with all kinds of creative ways to locate individuals in order to interview them. They will message people on social media. They might go back to some search capacity through here at the State Health Department. We have some ways that we can search for people as well. Generally, we try our best to find as much information as we can so we can catch these folks and interview them promptly. And again, just a reminder to be aware of not only Montana laws, but what your local health department policies are as well, because sometimes they might vary a little bit from what state public health will be doing. So now that we're ready to interview the case, you want to make sure that you have all of the appropriate forms that you need. There are specific CDC COVID-19 forms that can be used as sort of a guideline of things that you need to ask. That said, some local health departments might have this information on a separate form in terms of what they want you to collect from the client. Do what you can to make sure that you're aware of the circumstances around this client in terms of maybe their age, their occupation. Sometimes though, you might not have any information to start with. Make sure that you have already reviewed whatever script or interview tools that your team lead has given to you, and make sure you have those ready to go. And then of course, consider things like we mentioned earlier, translation services, accommodations for ADA as needed. When you're doing the interview, make sure to pause frequently, ask open-ended questions, ask the client if they have any questions. It's really important that the individual knows that, you know, public health is there for them to help, and we're caring about them and wanting to prevent the disease from transmitting further on. So this is all in the best interest of the community. Things to consider when you're discussing isolation with the case. It's important that they remain separate from others in their home as best as possible. Ideally, they would have their own place to sleep and their own bathroom. That's not always feasible though. So when that occurs, then we want to make sure that they have ways to keep things cleaned frequently, that they wear a mask when they're around others and can't maintain social distancing, to try to reduce the chance of spread within that household. Make sure that folks have access to food and water, and maybe someone who could bring it in for them if they don't have family members around. This is a great opportunity for communities to sort of rally behind each other and help out with these sorts of things. Consider things that might be challenging. Single parents, individuals who are caregivers for their elderly parents, for example, how are those duties going to be reassigned and helped out while this person remains in isolation? Keep your eyes open for things that might be warning flags that you have to report to your team lead. And then in the diagram at the bottom, there is just a snippet of one of the assessment checklists that CDC has on their webpage that allows you to kind of walk through this with the patient to say, do you have this? Do you have that? And how to accommodate for all the things they'll need while they're in isolation. This is a screenshot of one of the fact sheets that you can find on the CDC's website for COVID-19. This is a nice basic handout that you can give to clients when you're interviewing them, or really anybody who has questions about COVID-19. It's great to share on social media. But again, when you're doing these interviews, it's good to share this kind of information. Your team lead may have their own specific version of this. Nevertheless, it'd be good to bring something like this that they can have on hand to learn more about COVID-19. How to prevent it, how to practice social distancing, etc. Some local health departments here in Montana have done a really good job of creating what's called a self-care kit. And this is ideally to have a nice little care package sort of to help someone who is recovering at home in isolation to do the best they can to prevent it from being spread to others within the household. So again, this might include things like a cloth mask, gloves, a thermometer to assess their symptoms and whether or not they have a fever, and whether, if they do, whether or not it's gone away, cleansers, sanitizer, again, some information about COVID-19, instructions for how they should be safely assessed if their symptoms worsen. We usually don't advise people to just show up at the emergency room. Rather, we would recommend that they call ahead to their healthcare provider or the emergency room to say, I'm a confirmed case of COVID-19, I need to be assessed, I'm not feeling well. And that way they can have a heads up and sort of be prepared to be in proper PPE when that person arrives at the emergency room. It's also good to give some instructions for how to keep your home extra clean during this time, especially if you have to share it with others. And then some either a hotline or a warm line that folks can use if they have any questions as this comes up. So this might even be the public health department's hotline. A lot of local public health departments in Montana currently have COVID-19 hotlines. So if you have questions, you can have somewhere to reach out. And people really like knowing that there's someone there who will answer their questions if they have them, especially later on, you know, when they think of things that they didn't think of during the actual interview. So the next thing that you'll be doing during this interview is trying to figure out who the contacts to a case are. And this is really important because if we can understand and collect all of the information about who was around a case while they were infectious, then those individuals can be contacted and put into quarantine for that 14-day period to ensure that it's not being spread any further as best we can. Again, this is voluntary. There will definitely be times where people do not want to give up that information. People are worried that people get angry or that people will be upset that their personal information has been shared. But this is where the rapport comes in, and trying to get folks to understand that this is being done to prevent the spread, and that, you know, personal information is kept private, and it's important, again, to collect it in order to move forward with the contact investigation. So no indexed patient information is shared with these contacts. But the first thing that we'll want to figure out is, with this individual, they'll tell you when they began to feel symptoms. We want to make sure that we can pinpoint that date as best we can. Once that date is pinpointed, or I should say, if someone is asymptomatic, we'll use the date that their specimen was collected for testing. We'll want to look at the 2 days prior. So 2 days before onset of symptoms or the specimen collection, if they're not symptomatic, up until the day they were put into isolation. Who were they around? Now, a contact has been defined by CDC as someone who was within 6 feet of an infected person for at least 15 minutes. So this definitely means folks who are household contacts. People who live in the same house as a case are absolutely going to be contacts. But it becomes kind of tricky when people start to think about who their social contacts are or who their work contacts are. So it's going to take some time to get a complete list of individuals, but be sure to remind them that if they think of anybody else, they can call you and give you that information as it comes back to them. A lot of times people are a bit rattled because they've been diagnosed with COVID-19 and may not remember everybody they've been in contact with during that time frame. So again, we want to make sure we have a nice list, including their contact information. An address is great. A phone number is definitely needed, so that we can do further investigations to contact these individuals and get them into quarantine as soon as we can. This again is another excellent handout that CDC has that you can share with folks you are interviewing to show them the process that we're in the middle of. So, you know, here is how we do contact tracing in public health. This seems to be a very popular phrase right now in public health, but this is something that's been done for a long time. But in terms of COVID-19, again, we will be interviewing the patient. While we're interviewing them, that's when we identify who their close contacts are. And then depending upon where you are working, either you yourself or someone else will be assigned to basically trace these contacts, to contact them, to let them know that they've been exposed to COVID-19 and give them directions on what to do to keep themselves and their loved ones safe, basically going into quarantine and avoiding contact with others until they've passed their 14-day incubation period. And the rest of this basically says what you need to do with those contacts. So make sure that the contacts have their own support services, that they know what quarantine means, what to do if they develop symptoms, how to be referred to a healthcare provider if they need to, and when they can be released safely from quarantine, which is, again, is typically 14 days after their last contact with the case of COVID-19. So a few things to think about. Sometimes the contact that you're trying to find may not be available. For example, it could be someone who is a resident of a nursing home and may have issues with recall, and they may have someone else who's sort of their medical power of attorney who can be the person that you interview for them. Make sure that if you have children who are identified as contacts, that we're interviewing their parents or guardians. Sometimes though, it'd be good to interview both if the parents let you, especially older children, because they may have some more information that parents necessarily do not. There's a lot of tools out there that can be used to elicit contacts. Different states have different ways of using these tools. So be sure to work with your local health department to find out if they're using any and how to use those appropriately. Your team lead should walk you through how to record all the information about the contacts that you're getting and how those are shared with the individuals who will be tracing those contacts. And then consider all of the different ways that contacts can be notified. We talked a little bit earlier about being creative and messaging through social media or texting or just a straight phone call. We want to avoid doing any of these interviews or notifications in person at this point to protect folks from any potential risk to COVID-19. Then you'll want to follow up with the case and any necessary medical monitoring. Some individuals, as they move along through their illness, may have questions, may need to be referred to their healthcare provider for additional assessments. You'll want to make sure that when you're interviewing them again, that you come up with a way of connecting with them so that they can be contacted to find out how they're feeling. Are their symptoms getting worse? Are we ready to become out of isolation? So make sure that's set up beforehand, that you'll either have a phone or a Skype visit, or you'll text. We've had people who have used worksheets with like a calendar, and the calendar will say fever or no fever or any other symptoms that they have, and they'll take a picture of it and text it to their interviewer daily. So be creative and try to make it work for them. Remember that they're not feeling very well either. We'll want to make sure that they're aware that other people who might be reaching out to them, especially as case numbers increase. There might be other staff coming in to make sure that they're aware that if someone from public health calls them, that this is a legit call, and please check in with them. And then while you're monitoring them throughout the course of their illness, make sure that there isn't anything else that they need in terms of social support. If they need services for, if they need food, if they need water, if they need a ride to the doctor's office for additional monitoring, etc. A few things to consider in terms of people who are moving around. So sometimes you will have individuals who are in a hospital and they're being discharged from the hospital to sort of a step-down facility or rehab facility. Sometimes you have individuals moving from one type of long-term care facility to another. There are policies out there through the CDC that allow this to safely occur, but they have to be followed. So if you find that this is going to happen with one of your cases or one of the contacts who later develops symptoms, that public health should be referring to these policies and working with these particular facilities to ensure that that transition, that transfer, is being done as safely as possible. This may include some testing before they can be allowed to move, and they have to show that they're negative after being ill, that they have negative tests to allow them to move around. It's going to vary depending upon the situation. So just a note to refer to those policies at CDC. This is very similar to individuals who are being either discharged or moving from one type of correctional facility to another. Same thing, there is definitely some good CDC guidance on how to safely do this and when to safely do this. Sometimes if there is, for example, a lot of community spread of COVID-19 in a specific location, people may decide not to have any transfers for a bit of time until the amount of disease starts to decrease. And then tourists and out-of-state cases. Here in Montana, we're definitely a tourist hotspot. So we will have individuals be coming into Montana, and you'll find out that they live in another state. Like we mentioned before, those will not be counted as Montana cases. So we'll want to be sure that they are referred to their appropriate health department in their state of residence. Those tourists may be isolated in Montana. And again, if that happens, your local health department will be working with them to make sure that they remain in isolation and follow up with them to be released. But in general, in terms of case counts, they will not be counted as Montana cases. So if you do discover that, be sure to notify your team lead. Discontinuation of self-isolation. So again, someone who's a case of COVID-19 has been in isolation since diagnosis. And you have to, at some point, let them out of isolation. In some cases, it's so that they can go back to work. In some cases, it's so that they can go outside of the house. There are two ways to allow someone to get out of isolation. There's a testing-based process and a clinical-based process. Which arm you use kind of depends on what your local public health department advises. There are certainly some examples, like individuals who work in the healthcare realm who absolutely require a test-based process for getting out of isolation. What that means is once their symptoms have decreased and they're feeling better and they haven't had a fever for more than in the past 3 days, then they're tested, and they're tested 2 times 24 hours apart. If both tests are negative, they're considered free of COVID-19 and can go back to work. If they test positive and they're a healthcare worker, but they don't have symptoms anymore, they may be released from isolation because they meet a clinical-based process that I'll discuss in a sec. But they can't go back to work because their workplace policy requires the 2 negative tests. So just a few things to consider. Also, you want to make sure that the patient is aware of what this means. So when it comes for you to be out of self-isolation, here is the way that we are going to make sure you meet the criteria to be released. We talked about testing-based. The clinical-based process for release of isolation is basically that it's been more than 10 days since the onset of symptoms, that you've been fever-free for 3 days without the aid of any kind of fever-reducing medication, and that you're feeling better. And that's obviously a lot more simple than having 2 negative tests. So again, what process is chosen is going to depend upon the local health department or perhaps their employer. In general, most counties in Montana are using the clinical-based process. There definitely are healthcare workers who are being required to have the testing-based process to be released so they can go back to work. The most important part is to make sure the patient understands which process they will be using and that you will communicate that to them when they actually can be released. Discontinuation of self-isolation. So remember, we talked about individuals who are positive for COVID-19 have to be put into isolation for the duration of their illness to prevent the spread to others. So there are 2 ways that someone can be taken out of isolation, and that's a testing-based process and a clinical-based process. So a testing-based is pretty self-explanatory. What that means is that when someone is feeling better, in order to be released from isolation, they will have 2 COVID-19 tests taken 24 hours apart. If they're both negative, then they're released from isolation. The clinical-based part is based entirely on symptoms, and that basically means that it's been more than 10 days since their onset of symptoms, that they are generally feeling better, and that they have not had a fever for the past 3 days, and especially without the use of fever-reducing medication. Now, which process you use will depend on the local public health department. So they have the final say. However, they will be working with various businesses or hospitals in the community to determine which process they would prefer to use. Generally speaking, there are some workplaces like healthcare facilities, nursing homes that require the testing-based process. And that only makes sense because we don't want folks to come back to a healthcare setting when they could be potentially infectious. So having 2 negative tests to return to work in that situation just makes logical sense. You want to make sure that this is all communicated clearly to the patient so that they understand that here is how we're going to let you come out of isolation. Here are the steps we have to follow. Here's, how I'm going to tell you this or evaluate for this when the time comes. And again, if you have questions, make sure you refer to your local health department because it is in the end their decision in terms of what process will be used. This is the same information kind of broken down into the next 2 slides. So this first slide is for test-based versus clinical-based processes for someone who does not work in healthcare and they have symptoms. And so this is pretty much what we've already talked about, that your symptoms have improved for the clinical-based process, and then for the testing-based process that your symptoms have improved and you have 2 negative tests 24 hours apart. For individuals who were asymptomatic and also do not work in healthcare, again, this just breaks down the testing versus clinical-based approaches. This is where, it's a little interesting because individuals don't have symptoms to start. So how do you assess a clinical-based release from isolation without testing? And that's basically, again, that it's been 10 days since the test was positive and they continue to not have symptoms. Contact tracing. So up until this point, we've been talking to the patient. We've been getting information from them in terms of who they were in contact with while they were infectious. And now that we have a list of all of those individuals and their contact information, this is when public health begins doing some detective work to look to find these individuals and notify them of their potential exposure to COVID-19 and how to follow up with them through their quarantine period. So like cases, we want to make sure that contacts are notified as soon as possible that they were a contact to someone who has COVID-19. This means that there's the potential that they could become infected and become symptomatic with COVID-19 symptoms and potentially spread it to others. So we want to stop that as quickly as we can. Remember that we're not going to share any information about the index case with their contacts. Just like with the case, we want to consider if there's any translation services that are needed or any other accommodations that are required. Again, it might be difficult to locate some of these contacts. We're hopeful that we get as much information as we can from the case interview, but sometimes you don't get very much. So try to be creative in terms of how you go about getting some information, whether it's messaging them on social media, consulting the state health department for some other search capacities. And again, just a reminder to make sure you're aware of the confidentiality laws here in Montana, as well as any local policies at your local health department. Like a case interview, a contact interview will proceed, and you'll want to have your forms ready. You want to make sure that if you have a script, you've reviewed it and you're comfortable with it. Make sure that you're doing these interviews remotely when possible, by phone, by Skype, to reduce your risk of getting COVID-19. And make sure that you're in good communication with your public health lead should you have any questions as you move through this process. Just like with the case, you want to make sure you establish a good rapport with the contact. You want to make sure that they know that you're here for them, you care about them, you want to keep them safe. And so that's why you're reaching out to them to do this contact interview. So what do we have to do for quarantine? Well, individuals who, as you're going through these interviews, if you find that there's some contacts who are already symptomatic, then you want to make sure that they are self-isolating immediately and that they're referred to their healthcare provider to be tested or evaluated for COVID-19. And again, they want to do that safely. They want to call ahead and make sure that they are assessed, and so folks can be prepared and be in appropriate PPE to assess them. Any contacts who are asymptomatic are going to be asked to self-quarantine for 14 days from their last day they had contact with the case. So generally, when contacts are being notified, most public health workers will have that last date of exposure to the case, because the case will say, well, we were all at a dinner on Sunday the 23rd, and they'll have that date so that they can tell contacts, okay, your last date of exposure was Sunday the 23rd, so we want to count 14 days out from that, and explain to them what that will mean. Sometimes it's good to have a visual to show them a calendar, or ask them to pull out their calendar and mark when the 14th day will be. You also want to make sure that you inform them about what symptoms of COVID-19 are, and as well as what things to look out for that might require them to be assessed either by a healthcare provider or a visit to the emergency room. Again, safely assessed by calling ahead. There's things to consider for individuals who are contacts and they're asymptomatic, but they're considered critical workers. Again, consult with your local health department to make sure you're aware of whatever those policies are in that area. Generally speaking, there are some people who are considered essential workers who can continue to do what's called work quarantine. This means that they're still monitoring their health for 14 days. They're able to go to work, but they have worked out an agreement with their place of employment to be sure that they are monitored for the development of symptoms, sometimes like temperature checks twice a day. And if they do develop symptoms, they have to immediately take themselves out of the workplace situation and self-isolate until they can be assessed for COVID-19. Like case interviews, with contact interviews, you want to make sure that you establish a way to communicate with them and further monitor them through that 14-day period. So again, any close contacts to a case are going to be told to self-quarantine at home for 14 days. You want to try to maintain a social distance of 6 feet at all times. So again, that means if they're in a house with other roommates or other family members, they want to try to keep themselves as isolated as possible. You want to make sure that they're self-monitoring every day for symptoms of COVID-19 to avoid contact to anybody who is at high risk for complications due to COVID-19. So if someone lives in a household with an elderly parent, to be sure to stay isolated from them as best as they can to reduce the risk of it transmitting to that person should the contact develop symptoms. And then go through a protocol with that person to say, here's what's going to happen if symptoms develop. Here's what we want you to do to contact your healthcare provider ahead of time so that you can be tested to see if indeed you do have COVID-19. And like the case interview checklist, there actually is a self-isolation and quarantine checklist for those contacts who are in quarantine as well. Again, they want to be asked to stay as far from others as they can. Want to make sure that they have all of the services that they need while they're in quarantine. Consider challenges just like cases for individuals who might need some assistance, some help from the community to deliver groceries, to take care of elderly parents. Consider any red flags that might show up that you need to report to your local health department, and to remind the contacts about how to keep monitoring their symptoms during that 14-day period. And like we talked about already with cases, it's good to share these kinds of fact sheets with contacts as well, because they would probably have even more questions about how they could potentially have been exposed, what kind of symptoms to look for, how to prevent spreading it to others. Often people are really concerned that they're a contact in quarantine, and how are they going to keep their family safe now that they're stuck at home for 14 days? So these types of fact sheets are very helpful to communicate that information to contacts who have questions. Like with cases, it's really helpful if counties can provide some sort of self-care kit or information that they can have as they go through their quarantine period. And like we talked about before, these are things to basically keep them and their household as safe as possible in case they do develop symptoms during their 14 days, and how to protect people around them. And most importantly, some way of communicating with the local health department with any questions or needs that they have while they're in quarantine. Like the case, well, unlike the case, this contact generally is not symptomatic. So during this 14-day period, they're going to be evaluating and monitoring their own health to see if any symptoms do develop. So again, during the initial contact interview, you want to make sure that you've established how you'll be checking in with them, whether it's phone or Skype or texting. Make sure that they're aware of anybody else who might be checking in on them during that 14-day period, if there's other staff who will be doing that. And then a reminder for them of how to be referred for assessment by a healthcare provider and COVID testing should they start to develop any symptoms. And then you want to be able to close out your contacts after they have had their 14 days of quarantine. If they remain asymptomatic during those 14 days, then public health can reach out to them on day 15 and say that they've been released from quarantine. However, if any of those contacts develop symptoms, they should be tested. If they're tested before the 14 days are up and the test is negative, this does not mean that they can be released from quarantine with a negative test. They have to continue that self-quarantine period through the original 14 days. So this may mean that someone could be tested a few times during that 14-day period if they develop different symptoms and still, and are negative. Maybe they have a new symptom and they have to be tested again. If they do test positive, then they become a case. If they remain negative and they don't have any new symptoms through that 14-day period, then they can be released from quarantine. Sometimes there are unusual circumstances that have to be taken sort of case by case. So, don't hesitate to work with your team lead or your local public health department to make a decision on those. And again, this will be decided at the local public health level, and you want to make sure that that plan is clearly communicated to the contact when you first reach out to them. Here is how we're going to release you from quarantine. Make sure you answer your phone on this day, or make sure you answer your phone every time we call you so that we can monitor how you're doing. It's good to make sure that that's all laid out at the beginning, so there's not a lot of confusion as you get to the end of that 14-day period.
A close contact is someone who's been within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period. Someone can spread COVID-19 2 days before they have any symptoms, so it's important to either look back from an individual's symptom onset date or test date. If they have no symptoms, then it is recommended to use their test date. From that test date, look back 2 days prior to confirm any close contacts. If they were symptomatic, then use their symptom onset date and go back 2 days, 48 hours from their symptom onset date to elicit close contacts. There is an exception in K through 12 indoor classrooms. So this excludes students, and it's important to remember students instead of staff, who are within 3 to 6 feet of another infected student. If you have any questions, again, please reach out to CDEPI and we can help walk you through it. One incredible tool that some counties in Montana are using is SarahAlert. Through SarahAlert, contacts can be elicited from a known case. They can also identify clusters and quickly identify cases that are symptomatic and close contacts that become symptomatic. There is daily monitoring and symptom check-in. So how SarahAlert works is a known case will then identify close contacts. Those close contacts and the case's information will be uploaded into SarahAlert. From there, they'll get daily messages asking how they're feeling, if they have any symptoms, and if they need anything. This is an important part of the contact tracing process that often gets missed. So SarahAlert helps alleviate that gap through the daily check-in. If someone is experiencing increased symptoms, SarahAlert will then notify the local county health, and the local county health can then get in contact with this person or a medical provider to reach out to the individual to answer any questions that they may have. Most counties that use it consistently have great things to say about it. In particular, it's a great way to double check your close contact information. And it is a guide for tracking close contact information. If you want more information about SarahAlert, please reach out to me. My email is megan.gillespie@mt.gov, which is provided. Thank you.
So I'm going to take a few minutes to talk about some local examples of case investigation and contact tracing. Montana is a unique state, as you've heard earlier in this training, in that all of the authority is at the local health department level. So likewise, different contact investigations and case investigations might move along a little bit differently depending upon the county, especially in those counties that are larger and have a larger population. They may have a larger staff of public health workers, and they have different ways of going about these various processes. For example, there's some counties who will assign 2 workers per patient, and it's their job to do the investigation and contact tracing, and they stay with that person from beginning to when they're released from isolation. They stay with all of their contacts from their first notification until they're released from quarantine. And then they are assigned new ones as those original ones are released from their isolation or quarantine periods. In a smaller county, you tend to have public health that wears very many hats. There might be 1, maybe 2 people who are the source for all things public health for an entire county in Montana. And so they are usually the only people who are doing these investigations and contact tracing. But sometimes we'll bring in some help from other areas in their county offices to do some of these things. And of course, this is what this training's for, because you may find that you're being asked to help some of these smaller health departments to do their contact tracing as their case numbers start to rise beyond what they're capable of handling. A few